as we came to understand it, your hair grows faster than most other things in your body. So that would
Right.
be a byproduct of the targeting of proliferating cells. Is that correct?
Yeah. So your eyebrows, your toenails come off.
Right.
These are horrible.
Mm.
These side effects are horrible.
Mm.
You know, you lose,
Mhm.
yeah, I mean, you lose your eyelashes, you know, your tongue, you know, your gut. Remember I told you your gut is turning over
Turning over.
2 or 3 days rapidly. That's why so many chemotherapeutics really have such bad GI effects. But going back to Gary's question about combination therapies and resistance, well, one with AOH 1996, you know, if it holds up for being very non-toxic and effective for treating cancer, of course, you can now, what you do is and not just AOH 1996, this happens all the time. The thinking now is we're not going, it makes big pharma unhappy because they always want one big drug, you know, that's going to treat everybody. But now that the one big drug, or they call it monotherapy, we're moving away from monotherapy and more going towards what they call cocktails. Okay. Is that you will put together a variety of drugs, you know, like treating testis cancer.
Chuck knows a lot about cocktails. Chuck knows.
I knew that gag was coming.
Yes.
Yeah. So my joke is that AOH 1996 will be the olive in everyone's cocktail. So like that.
Look at that.
Yeah. So so two things with AOH 1996. Great hope down the line if it proves to maintain its non-toxicity. I hope that we've already done studies in animals to show that it complements a variety of currently used drugs. And in the presence of our drug, we can actually lower the amount of some of these very toxic drugs very significantly. So the animals can have, you know, they can still show very effective growth inhibition of the tumor, but they're not sick. But your thing about resistance, this has come up a lot for me for this drug, for AOH 1996. My lab has worked really hard at trying to make resistant cancer cells. Cancer cells love to do this. I mean, like I was talking about the patient, you know, the lung cancer, ovarian cancer patient, they respond beautifully, but in a year or two, their cancer comes back.
Right.
And they're resistant now.